Postpartum care is an afterthought, and it's failing women. There's something we don't talk about enough. Not during pregnancy, not during labor, not even after birth. And that's what happens to women after the baby arrives. Because for all the attention we give to delivery, postpartum care is treated like an afterthought. And that quiet neglect is failing women. For many women, birth is treated like the end of the story. Once the baby is delivered, the assumption is that everything else will settle on its own. There's a brief hospital stay, a few instructions, and then one visit 6 weeks later. As if recovery follows a calendar. It doesn't. After birth, women are recovering from far more than delivery. They're recovering from hormonal shifts, blood loss, sleep deprivation, physical trauma, emotional whiplash, sometimes surgery, sometimes fear, sometimes an experience that didn't go as planned. And yet, the expectation is often, be grateful, be strong, move on. That's not care. That's endurance. We screen for postpartum mood disorders. We ask a few questions, we score a form, but listening takes time. And time is what postpartum care rarely allows. Anxiety doesn't always look dramatic. Depression doesn't always announce itself. Sometimes it shows up as silence or guilt or the quiet belief that something is wrong with you. When those signals are missed, women don't feel supported. They feel invisible. Whether a woman gave birth vaginally or by cesarean, the body needs care. Pelvic floor changes, core weakness, pain that lingers, symptoms that feel unfamiliar. Too often, women are told that is normal. Sometimes it is, sometimes it isn't. But without space to talk about it, normal becomes a way to shut the conversation down. Postpartum care is under-resourced, under-prioritized, and underestimated because the system moves on quickly to the next baby, to the next delivery, to the next patient. But when mothers aren't cared for, families feel it, and the effects don't show up immediately. They show up later, quietly, and everywhere. In many parts of the world, postpartum care doesn't end at discharge. It includes home visits, structured follow-up, and protected time for recovery. Not because women are fragile, but because recovery is respected. Those systems weren't built on luxury. They were built on the understanding that how a woman is cared for after birth shapes everything that comes next. Real postpartum care would mean continuity, follow-up beyond one visit, permission to speak honestly, support without judgment. It would treat postpartum not as a footnote, but as a phase. Because how a woman is cared for after birth shapes how she carries motherhood forward. When women don't feel supported, they look for something the system didn't give them. In the next episode, I want to talk about why doulas exist and what their presence reveals about the gaps in modern maternity care. Not as a threat, but as a mirror. Final note for you. This episode doesn't shout. It stays. It will resonate deeply with women years past birth, partners who watched quietly, clinicians who know this is true but rarely say it. You're pacing this season exactly right. When you are ready, episode 9 will feel inevitable.